by psoriasis. It's an uncomfortable skin condition that shows up as a patchy rash. And joining us today is Dr. Stephen Mahoney. He is here to raise awareness about this disease and also help those affected seek proper treatment. Also joining us, patient Evan Mallett. Good morning to you both.
Good morning. Thank you.
Doctor, first off, how do I determine if I have psoriasis?
Well, psoriasis is a condition that's, as you mentioned, is 7.5 million people have it. So it's in the public sector. It's immune rate mediated and it's largely genetically passed on. So we see it in families. It can come up by itself in someone with stress being a trigger, infections being a trigger, sometimes weight gain even being a trigger. So what I would look for in a patient is if they have a rash that seems to last longer than 2 or 3 weeks, a month, and doesn't go away, and favors some of the chronic areas we see, like the elbows, the scalp, the knees. You know, some people mistake it for dandruff, and it's not really dandruff, it's been psoriasis the whole time.
Well, and speaking of mistaking it for other things, it shows up often in different ways. What types of psoriasis are there?
Well, there's 5 types, the most common being just plaque psoriasis, which affects about 80 to 90% of patients. And this is large plaques that involve these areas that are pretty characteristics, like the knees, elbows, kind of trauma points. It can come in other fashions where there's little smaller areas. It can be little blisters. So sometimes it's difficult to make that diagnosis, but most dermatologists could make it without too much trouble.
Interesting. And Evan, you have personal experience with the condition. Tell us how it's affected you.
Well, it actually started out back when I was about 13 years old. So through my teen years, I had a lot of red, splotchy, and scaly skin. It's very uncomfortable to let my skin show. So I pretty much wore long sleeve shirts and long pants every single day for basically the last 20 some odd years, you know, until some of these newer medicines came out. All that was really available was creams and steroid ointments and whatnot.
Oh, that must have been very difficult for you. Doctor, you know, speaking of modern treatments, what is out there right now that can help people affected by psoriasis?
Well, the treatments we have now, in addition to the topical steroids and the light therapy that has kind of been the standbys, is we now have a new class of medicines called biologics, which Siliq is the newest of that class. These are medicines that are sub-Q injections, so you would give it like you would give yourself an insulin shot. And these medicines target the inflammatory proteins that are causing the skin condition and causing the arthritis and causing some of the damage. And by either blocking them or their receptor, they're able to kind of put the disease back into remission and make it, you know, make the patient clearer.
Very interesting. So it sounds like you're having some good results with that treatment. You know, people are always curious with the new treatment what the side effects may be. Do you care to comment on that?
Yeah, all medicines have side effects, and you know, if you watch one of these TV commercials, they have to list all of them, and sometimes they can be kind of scary.
Oh, yes.
Most of the side effects that we see with this medicine, I know, it's like people that didn't die do great, but it's one of these things that you would, about less than 1% of people we have that notice any side effects, and sometimes they're mostly like upper respiratory infections and maybe some skin infections that show up, but they're usually very manageable, and most of my patients do very well on these new medicines.
Well, Dr. Mahoney, Evan, thank you so much for joining us this morning from Houston.
Thank you for having us.
Take care. August is Psoriasis Action Month, folks. For more information on the treatment, visit the website right there on your screen. We'll also have this interview on our website. Ortho Dermatologics are proud sponsors of the Morning Blend.